If you're dealing with peripheral artery disease or PAD, you already know that nighttime can be, well, the absolute worst part of the day. So today, we're going to dive into how you can find some real comfort, improve that circulation while you're trying to sleep, and finally get the rest you've been missing. Does that sound familiar? You're definitely not alone. That aching, that burning or cramping that just seems to crank up to an 11 the second you lie down, it's a frustratingly real part of having PAD. We're going to break down exactly why that happens, and way more importantly, what you can actually do about it. So here's our game plan. First, we'll get into why PAD pain loves to show up at night. Then, we're going to tackle something called the circulation paradox. It's a big source of confusion. After that, it's all practical stuff, the best sleep positions and the ones you absolutely have to avoid. We'll finish up with a simple nightly routine and the critical red flags that you should never, ever ignore. Okay, first things first, why on earth does just lying down make everything feel so much worse? It really all comes down to some basic physics and how your circulation works. So just as a quick refresher, PAD means the arteries that carry all that good oxygen-rich blood down to your legs and feet are getting narrow. Now, during the day, when you're up and walking around, your leg muscles are actually helping out. They act like little pumps, squeezing and helping push blood through those tight spots. And this is the perfect way to think about it. At night, your whole system slows down, right? Your heart rate drops, your blood pressure goes down, and those helpful little muscle pumps in your legs, they're completely off duty. All of a sudden, your heart is having a much tougher time pushing blood through those arterial construction zones. And that's it. That's the traffic jam that's causing all that nighttime pain. This brings us to a really big point of confusion for so many people with PAD, and that's all the conflicting advice you hear about elevating your legs. Come on, you've probably heard it a million times for tired or swollen legs, just put your feet up. But when you have PAD, that bit of common wisdom can actually backfire big time. So let's clear this up once and for all. This right here explains everything. It is all about the direction the blood needs to go. See, with venous issues like varicose veins, the problem is getting the old, used blood back up to the heart. So elevation is great. Gravity is helping you out. But with PAD, your problem is the exact opposite. You're trying to get fresh, oxygenated blood down to your feet. When you elevate your legs, you're making your heart fight against gravity, trying to pump blood uphill through already narrowed arteries. And that can actually make the pain worse, especially if your PAD is more advanced. All right, so now that we get the paradox, let's talk solutions. How can we actually use our sleep position and gravity to help our circulation, not hurt it? Okay, I know what you're thinking. Didn't we just say elevation can be bad? And you're right, but here's the crucial detail. For mild PAD, a gentle elevation can actually be really helpful. It can reduce swelling and improve that overall flow. It's all about finding that perfect sweet spot. And here's exactly how you do it the right way. You're going to lie on your back, use 1 or 2 pillows, or even better, a wedge, to raise your legs about 6 to 12 inches. You want them just a little bit above heart level. And this last part is key. Make sure your knees stay slightly bent. That little bend prevents strain on your joints and just makes the whole thing a lot more comfortable. Now, if you're a side sleeper, listen up, this one's for you. Sleeping on your side, especially your left side, can improve your heart's efficiency. But the real trick here is to stick a pillow between your knees. What that does is it keeps your spine nice and aligned, and it stops your top leg from putting pressure on the blood vessels of your bottom leg. Simple but effective. So, let's do a quick recap. This little chart gives you a rating at a glance. For mild PAD, that elevated back position gives 5 stars. It gives you the best gravity assistance. Left side sleeping with a pillow is a fantastic 4-star option. And just sleeping flat on your back? Well, it's better than nothing, but you're really missing out on the benefits you could be getting. You know, what to do is important, but what not to do is just as critical. Some positions can actively sabotage your circulation and make your symptoms flare up. Okay, first, sleeping on your stomach is a definite no. It puts direct pressure on the arteries in your legs and it twists up your spine. Second, while hanging your legs off the side of the bed might feel good for a minute, it's a bad long-term habit because it can lead to swelling. And finally, just avoid any position that squishes or compresses your legs, like a really tight fetal coral or, of course, crossing your legs. Look, positioning is a huge piece of the puzzle, but it's part of a bigger picture. If you can build a smart little routine before bed, you can make a pretty big difference in your circulation and how well you sleep. These are all so simple, but they're incredibly powerful. Think of it like a pre-sleep circulation boost. A nice warm foot soak, maybe 5 minutes of light leg stretching. Keep your feet warm with socks. Remember, cold makes blood vessels constrict. It goes without saying, but avoid stimulants like nicotine and caffeine later in the day. And finally, make sure you're hydrated and try to keep your room on the cool side. It just helps your body regulate everything much better. All right, we need to shift gears and talk about something that is incredibly important. While all these tips are great for managing symptoms, there are some red flags that you can never, ever afford to ignore. These are not symptoms where you wait and see what happens. If your pain at rest becomes constant and severe, if you notice your feet are looking pale or bluish, or if you have a sore on your leg or toe that just won't heal, it's time to call your doctor. And pay very close attention to this one. If you get a sudden severe pain and your leg feels cold, that is a medical emergency. You need to get help immediately. Early treatment can honestly make all the difference. So we've covered a lot. We've talked about the why behind the pain, the paradox of elevation, the best and worst ways to sleep, and those critical warning signs. You now have a whole toolkit of small changes that can lead to a really big improvement in your sleep. So the only question left is, what's the one change you're going to make tonight?